everybody, welcome back to Second Chance to Dance. I'm Nicole, and today I want to introduce you to Spirit. Spirit is a 12-year-old 16 3-hand standard bred that lives at Leilani May Horse Rescue around the corner. He was rescued in October, the middle of October 2020. He had Amish road shoes on when he arrived at the rescue. He started off life as a harness racer. Apparently he wasn't very good at that because he didn't last long. And apparently he wasn't very good at being an Amish buggy horse either because he's only 12 and here he is. Amish usually use their horses until they can no longer be used. But Spirit is pretty sound. He's a little off, but that could be due to being out of shape, or it could be due to an underlying issue. When Spirit arrived at the rescue, he still had his USDA tag on from being in the kill pen and headed to Mexico. So thank goodness that Leilani May was able to rescue him. Spirit is here because he got a bite wound. Horses bicker among themselves. There's always a hierarchy. Some horses are in charge of other horses, and he got caught in the crossfire somewhere and somebody bit his shoulder. And it happens. It happens to anybody that ever owns horses. If you own more than one horse, the other one of them is going to bite the other one. It's just a fact of life. But he got bit so hard that it chipped his shoulder blade. And when we saw him, we were actually out at the rescue. Doc and I were out at the rescue to see another horse that day. And we got done with that horse. A volunteer came up and said, hey, this horse has a big hole in his shoulder. Can you guys look at it before you leave? So we went to look at him, and sure enough, Doc pulled a bone chip out right then. So Miss Debbie that runs the rescue, she fought with it for about 2 weeks, and it just wasn't healing. It was getting bigger. It was trying to granulate, and it wouldn't close up. So she sent Spirit over here because Miss Debbie has 40 other horses to take care of, and that way Doc could come here, monitor it. I could keep him in a big, 12 by 24 stall because he's a big dude. But he came over here. He's been in the stall. Let him out in the round pen a couple of times, but he was trying to encroach on Caesar and Dee Dee's relationship, and him and Caesar were having little tiffs, and I didn't want him to get hurt again, and I didn't want Caesar to get hurt, so he stays in here. So Spirit was here for about 2 weeks before we did his surgery, just to see if maybe if we kept it covered and we kept it bandaged and we kept it packed, if it would close up on its own, and it just wasn't. We opened it up, we took out all the dead bone, dead tissue, closed him back up, and he is healing up beautifully. Doc came out and took some x-rays of it before we did surgery, and you can see that there was another bone chip, and that part of the bone was changing colors around the edge of where it had chipped. So Spirit has been quite an adventure. He is a very playful horse, he is a very smart horse, and he is a very bored horse in this stall. So I like to compare Spirit to a 2-year-old that you left unattended for 10 seconds too long, and they took off their diaper and they painted the walls in poop. Because that is what he does. He plays in the shavings, he plays with the hay. I put this Jolly Ball up for him. I don't know if you can see it. You can't see it past him. Hey! It's like a little bouncy ball. I haven't seen him play with that. He did destroy a feed bowl playing with the feed bowl. So Spirit did have a ground feeder bowl when he first came here, but Spirit decided to use his bowl as a volleyball slash trampoline slash frisbee. So now he eats out of the hanging feeder, and I take it out of there when he's done, because yeah, that that bull has seen better days. But he's a good boy. He's a sweet boy. He's not super duper trusting. You know, if I go to touch his face, he kind of scoots away. But if you go slow, he's alright. He's had a rough life. So we want to get him through this so that way he can have a long, long time of being a very happy horse. You be next? What do you think? You're silly. Today's Spirit's big day. We're gonna do his surgery on his shoulder. When the horse bit him, it chipped his shoulder blade. So, sometimes when a bone chips, the surrounding bone can die off. And then it creates this big, well, that. I'm sure Doc can explain it better than I can. But basically, it's trying to push out the dead bone so it can heal. Woo! So we're gonna go in and scrape out that dead bone and put it all back together the way it's supposed to be so he can heal up and he can go back to the rescue. So the first things first, we're gonna take his temperature, make sure everything's good. Can you explain that bump on underneath the skin and what that bone is doing?
So the bone is basically dead, and it acts as a place for bacteria for infection to hang out. And because it's porous, it's really hard to get rid of, because bone is porous.
Mm-hmm. So we take the dead bone out, and that way he can put down good new bone, right?
Mm-hmm. Yes.
And it won't be a house for that infection to live. Cool. So Doc always takes their temperature first, then she listens to their heart, gets their heart rate. Normal heart rate's 40. If it's elevated, it can be a sign of pain or discomfort. And she'll listen to his belly, make sure he's got all the good rumbly tumblies. And she has a measuring tape she puts around the middle of them, which tells her how much he weighs. There's 4 quadrants when you're listening to their stomach. There's 2 on this side, 2 on this side. So she's just checking all the places, make sure everything is flowing as requested. Or as it should. This is the weight tape. I think last time we taped him it was what, 10:57? 11:11, something like that. I don't either.
That's why I write everything.
Maybe it was 12:05. Yes, that's why I write everything down.
It's still 11:11.
Okay.
Not there yet. Oh, it doesn't look that bad. It looks better.
Doc told me I wasn't allowed to touch that for the week, so that it would be nice and soft and we could get good margins. So that's why he had that black hood on, so it would stay clean and I could resist the urge to try and help it. Spirit is a very big boy. I don't know if you can really tell. I'm 5'7", 5'8" on a good day, and he's every bit of 16'3", 17 hands. Yeah? I think I might be on. What do you think?
I don't know.
She says you're not quoting me on that.
You're not
So this
very
is
good
just
at-
a little bit of sedation.
You're not very good at guessing.
I'm not very good at guessing height, no. So first things first, and wash them up, clean all the dirt off of there, and then Doc numbs him up and uses that little probe to find the pocket. She makes her incision right where that hole leads to. That hole is what wouldn't close up for us. So then she takes out all the bad tissue and the dead bone, makes sure that the margins are all clean, everything looks good and healthy in there, and then cleans it up, wipes it down, and sews him back up. And within 2 days, the hole closed up. Don't even think about it. Hey, buddy boy. How did you custom fit your shoulder guard here? Let's see. Now, that would definitely be what he got caught on. So I'm gonna push that down in here. You're gonna need to get some wire cutters and cut that off of there. Yep. Yep. There's the staple that was holding it. So we don't have to go get the magnet. We can get the wire cutters. It's still covering your boo-boo. Haha. Now he's healing up beautifully. He's gonna be here for about 3 more days, and then he'll head back to the rescue. So I hope you enjoy his story.